Hello, everyone, and welcome to our series of real working caregiver stories. I'm Selma Archer,
I'm Zach Demopoulos.
and we are so excited to have our guests with us today, Carla Velastegui. Carla and I met at the recent National Alliance for Caregiving Summit back in November, and she started to tell me about her story, and I said she would make a perfect guest for our audience. So, welcome, Carla.
Hi, Selma. Hi, Zach. Thank you for having me here and for welcoming me into this space to share a little bit more about my story. I'm really excited.
So we'll just get into it. Let's start by having you share your care story. I know you told me that you started your story at a very young age. So let's just talk about it.
Yes, so I got thrown into the world of caregiving in my early teens. My mom was diagnosed with young onset Parkinson's in her mid 40s, and at the time, my mom didn't speak fluent English. We had never really had any experience with the healthcare system. And so all of this came as a wave of full of unknowns. At the beginning, for me, I didn't even know the word caregiver existed. I was just a daughter who was showing up for her mom, who was helping with translating appointments, advocating, and making sure that she knew what was going on and kind of what her care plan would look like. And so that's been my world since then. My mom has been living with young onset Parkinson's for 16 years now. And as her needs have changed, what caregiving for me looks like has changed as well. So definitely, it's more medication management, appointments, coordinating, handling paperwork, um, tracking symptoms, coordinating with different providers. All these little actions that are essential to her care and to her well-being, but that also add up. And so I think just throughout this whole journey, I've realized that caregiving isn't just a kind of a one person or a one family situation. It's, multiple systems that are supporting and at times not supporting caregivers and people supporting loved ones navigating a tough health condition.
So as you transition through the whole caregiving process of your mom with Parkinson's, my mom had Parkinson's as well. Um,
Wow. Okay.
yeah, and as you started, in your 16 years ago, do you think that's gotten less difficult through, from the beginning to where you are now? Has the care gotten difficult or more difficult? More difficult or less difficult as the years have gone by?
I think it's a mix of both in some way. So definitely some of the needs have increased. That is a degenerative condition. And so my mom definitely needs a lot more supports. But I would say that I feel like now we have a bit of a group, or now I also know where to find resources, where to reach out, how to advocate, how to ask questions, how to be able to kind of support my mom. And I know I always say, doctors they're specialists in their fields, but I truly do think that we as caregivers are specialists of the person that we care for. And so now, I've had 16 years of being Gina's, who's my mom, Gina's caregiver. And so in some ways it has gotten easier to show up better for her and to be able to advocate for her needs. But it also comes with these challenges of just supporting someone with a degenerative chronic condition.
Great. I love that.
I love what you said. We're the
Yeah.
specialist for the person we care
Yeah.
for. We haven't heard that one, Selma.
I love
I
it.
love that. And
Yeah.
I can't agree with you. I can't agree with you more. We are, we may be in front of a specialist who's got years of medical school experience, of course, and patience, but we know the person we care for the best. What's your mother's name?
Gina.
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 That's right. You did say. How is your mom doing?
She's doing okay. We have some good days and we have some okay days. We take it one day at a time. We take it kind of one week at a time. And, we really to focus on what is her quality of life. So for her, that's being able to go outdoors, walk, do activities in the outdoors, be able to keep like as much independence as possible. And so we try to incorporate that and plan for that around her care. And we shift. I would say with some days are great. Some days she's like so mobile and so engaged and she feels great. And some days are a bit more challenging. And so then we just adjust and shift and we try to support her kind of in how she's feeling for that day.
Someone in their teens has to be completely challenging and overwhelming, because it's very challenging and overwhelming for older caregivers. But in your specific case, I mean, were you going to school? Were you working?
Yeah, so I was in school then. I was in high school, and I would say back then I didn't even know that the word caregiver existed, and I didn't know for quite a few years actually. So going through this experience, it was kind of like I was living two different realities. One was going to school, trying to decide what courses I'm taking. I was also a cheerleader back then, so preparing for competitions. Eventually, deciding where to go to school, what do I want to study. And then kind of my other reality was going to ER, hospital visits, trying to contact different providers, drive my mom to appointments, advocate, translate, follow up on certain medications, all these different little things. And so I would say it was very overwhelming, very isolating. I didn't know anyone else that was navigating the same situation that I was navigating at my age. And there also wasn't a lot of supports that existed out there. And so it just kind of felt like this is what got thrown my way. There's nothing my school can do, nothing a guidance counselor can do. Um, so it was kind of like, I guess it is what it is. I just have to deal with this. But it was definitely a very kind of lonely, overwhelming, and at times frustrating journey, especially at such a young age of trying to navigate supporting a loved one alongside everything that, teenager is kind of wants to do and explore and learn.
If you don't mind sharing just a little bit more about that, because we've had a young caregiver
Yeah.
on our series in our series, and he shared some really honest, painful things. And if you don't mind sharing, what was it like when a lot of your peers, a lot of your friends, even family members maybe didn't get what you were going through? How'd that make you feel, and how'd you deal with that?
I mean, it's definitely like a memory that I have like very fresh in my mind, like very ingrained. Was I was deciding kind of where to go to university. And I had all my peers around me, and everyone wants to get away from home and move out and kind of be as far away as possible. And all these different schools. And for me, kind of an additional factor that I had to consider was I knew that I needed to be close to home in case if there was an emergency, in case that I needed to drive my mom to an appointment and help translate, that I could easily be accessible and show up for her. And it was just something that other people didn't really get. And it was something that I didn't really share. But it was definitely kind of a factor that I knew it was very important in kind of how I wanted to show up for my mom's care. So it's definitely challenging to kind of have this added responsibility and this added, in a way, kind of added thought of thinking, cognitive load, that some of my peers didn't have, and that even some of like my guidance counselor like couldn't really understand or know how to support me in those situations. Which again, it kind of left me like isolated, feeling a little bit overwhelmed, and just feeling kind of defeated at times because it's there was kind of really nothing or no one there to help navigate what that looked like, or even a support like an existing system in place that could actually help me as a young caregiver navigate what this looks like.
Thank you for sharing.
Did your caregiving experience taking care of your mom, did that influence the work that you do now?
Absolutely, in every way. So I I think being involved in the healthcare space, I got exposed to so many different parts of healthcare that I knew I wanted to go into that world. I think the for me seeing early on a lot of the gaps that existed, and kind of some of the inefficiencies that we see around our healthcare systems, I knew that I wanted to go in more into the tech world to see how technology can help make healthcare more accessible, more equitable, and just generally um, more scalable in a way, because we would always be sitting in the ER offices or have the wait times, and I thought there has to be better ways. And so that's how I kind of went into the health tech space originally. Often I worked with startups to government to private organizations on really understanding the different ways that technology is being incorporated across the healthcare system. And through that, I started seeing these gaps where, these new tools were being created for patients or families and even clinicians. But then when they were being rolled out, they weren't being trusted, and there just was no uptake for these products. And then when I would kind of step back and look at, work with technical teams and product teams, and I was like, who do we talk to? Who do we interview? Who are we designing for? And I started realizing that we were seeing these gaps that oftentimes businesses and organizations are designing for the easiest to serve patients. And so then everyone else is falling through the cracks, or we're not actually taking the time to understand some of the potential trust issues that people may have, or some of the just inefficiencies of rolling out this whole new tool into a clinician workflow or into a family caregiver that just won't make it realistic to incorporate. And so that's how then I started moving more into more advisory and kind of governance roles. And so now I work with researchers, with some government bodies, with some tech companies, really around how do we embed caregiver and patients into design, into policy, into programs, not just as a token voice or just as a check mark that we select and we move on, but actually as co-designers, so that we're looking at it from like a risk management perspective, from a quality perspective, and that we are truly designing for our end user, which is actually the patient, and incorporating that into how we are thinking about these new technologies that we're hoping to roll out into the way that we deliver healthcare. So absolutely, it's been influenced by my experience supporting my mom through the healthcare system in every way, but also just through, I often see that for me, having the privilege of speaking English fluently, knowing the healthcare system, working in healthcare, it is just so challenging for me to navigate and support my mom that I need to be able to make it better and help to make the space better for so many other people who don't have all these privileges that I have. And so that's absolutely a driver for me as well in this space.
So just a follow-up to that, you mentioned technology. How does AI, or what role does AI play in helping patients and caregivers make better decisions currently, and how do you see it changing in the future?
I mean, I think the biggest one that we can see is it can help us reduce some of that cognitive load that we're just carrying all the time. So those reminders, those appointments, those calls, those notes, I think AI can really have the opportunity to help us remove some of those kind of manual tasks that we do on a daily basis that can just kind of happen in the background and help us out and just give us that quick update or that quick reminder. I think a really, really big one and a huge important one that we're seeing right now is also the ability to be able to use AI and different bots to help us better understand the condition that we're navigating, help us understand the best way that we can use like our treatment care, and how do we apply it to the everyday realities that we live in. And I think there's a huge opportunity there in education. And so I'll share a quick example for me. The fact that I can now input some information that I need to communicate with my mom and just have it translated in a few seconds in a way that my mom can understand it has been a huge weight off my end in terms of that cognitive load of me sitting and having to type everything. I think something else as well is it can help us with better understanding some of the data that we have. We have so much data that we collect through whether it's a phone, a watch, a device that we're using, even data on like medications. And it's really hard as a person, as a patient, or as a caregiver to be able to make sense of everything and then to be able to apply it to your health. And this is where AI has been really, really impactful in helping us make sense of that data and then helping us be more prepared, more ready when we show up to those appointments, when we can actually come up with kind of a summary or updates of our health or the loved one that we're caring for, and then we can discuss that with our provider so that they can also make the best decision based on all this information that we're now able to provide them that's processed, summarized, and concise. And then I would say, I think there's so many opportunities there, but the one kind of item that I also want to make sure we do talk about is that AI and technology, at the end of the day, it can be a supportive tool for us, but it's never going to replace that human care and that human love that a provider, so a caregiver or a clinician can provide. And so instead it supports it. It should be something that happens in the background, that's supporting us, that's making day to day less overwhelming, that's helping us make decisions more confidently, that's helping us understand our condition and remove some of those admin tasks. But it will never replace kind of that human care. And the success of it will be by seeing someone use it, but not even knowing that they're fully using it. That's how I think it will be really the success of I think any technology being implemented and rolled out.
Great, thank you.
Wow, you really were influenced by your caregiving experience. I mean, you could just hear you talk, and you're applying your lived experience to whatever it is you're doing, which the recipients are going to benefit from whatever you're working on, Carla. So that's awesome that you've picked this career. I see that you tie in caregiving to almost everything. I saw there was an announcement that you were on the Canada's Drug Agency. Congratulations for that. That's a
Yes,
big
Thank you.
role. And when you announced it, you said your role is you're going to make sure that caregivers and care recipients are being connected for a better healthcare system. So you're working on healthcare systems, I understand, even across, outside of Canada, right? And I'm just curious, are you seeing any best practices that we could pick up that maybe other countries listening in might say, hey, that might be a good idea. We should try that.
Yeah. So I want to start off by saying I don't think, we have a country right now that's getting it perfectly and that I will say, they are doing the best and they're 100% and that's a gold standard. But I do think that we're getting there. And I think that I see it across different continents. Everyone has something that's working really well and everyone has something that they're trying to work towards. And so I just want to start off by saying that no country has it perfectly right now. But I will say that something that I have noticed more in the European health systems is there's a little bit more of larger awareness and societal supports in place. So, for example, when we look at Germany, there is mandatory long-term care insurance. And so what this looks like is that when we think about family caregivers, is that actually family caregivers can receive some benefits when they're caring for a loved one. What this means is that they can also continue receiving pension contributions, which is a huge issue when people drop out of the workforce and then they are unable to contribute to their own pension themselves. And then there are also some more kind of recognitions and support, safety supports for caregivers who are taking leaves. Because we know that caregivers at times they have to take a leave and it can be a very kind of one-on-one conversation as to what that looks like sometimes in the US. Then when we look at Sweden, for example, some of the Nordic countries, I think we see elder care specifically a little bit more centralized across different parts of society. So the load doesn't just fall on families. And so what I mean by that is there is subsidized elder care. There is more accessible in-home supports for people. I think there isn't really that assumption that the care will solely fall on families, but it's going to be absorbed from kind of like a shared responsibility. And then I think the other part is like the larger theme that I've noticed across all is really around the idea of like recognition, which I think we don't often see it across Canada and the US. So that idea that caregiving is named, there's some structural programs in place, whether it's workforce protection or workforce leaves, or there's structures around some of the supports like subsidy supports for home care or some of the financial recognitions for caregivers, family caregivers. They're embedded into policy, they're embedded into structures. So I think that's like kind of a little bit of a difference. I think in the US and Canada, we have some of those pieces. Of course, they vary by state, they vary by province. But I think they're a little bit fragmented and they're a little bit challenging to access if you don't know about them, if you are not working for an employer who has those benefits or who has those policies in place. So I think oftentimes that navigation burden lands on families. And I think the larger issue is that it's not always recognized. Caregiving is not recognized across society or in our systems yet or in our policies. And so it's very kind of a one-off depending on, again, where you're located, who you're working for, what healthcare system you access, who your insurer is. So that's a bit of the differences that I see, and that I hope I'm able to continue learning more about kind of all the systems across the world to be able to to figure out where are the places that are doing it really well and where are the places that caregivers are able to succeed and thrive in both caring for their loved one, but also in being engaged and active members of their society.
I, well said, and I agree with you. And especially when you this doesn't fall necessarily on one person's shoulder. So it is societal, it is personal, family, it is friends and other resources, but it is also an employer. Just curious, you work on a lot of boards. Are you on one that directly speaks to an employer? And if you do, or if you don't, what would you say to an employer today if you had a suggestion to give them?
Yeah, so I do some work with employers or some larger kind of employer organizations to be able to bring awareness around caregivers and what that looks like when we look at the workforce. So, I think across Canada and the US, actually, it's about 1 in 5 individual is a caregiver across both Canada and the US, and that number will only continue to increase. And so it's a reality. It's happening, and it's invisible, but it doesn't mean it's not an issue that we need to be aware about. So I would probably say one of the biggest things is to normalize it and operationalize it. And what do I mean by that is just we're not just here, creating awareness and saying caregivers exists. But what that means is how do we recognize that our workforce at any given level of seniority, at some point or another, will be a caregiver across every single industry. And so, how do we have the right supports internally? And what that could look like could be how do we train our managers to be able to know how to have these conversations with their teams? How do we set up clear structure supports internally so that there are, for example, structural policies for leaves, structural policies for flexible workplaces, for hybrid. What do we, when we look at kind of benefits, how do we actually think about an inclusive idea of benefits that actually include dependents? And when we think about dependents, not solely children, but also dependents who are adults. Because that's something I often come about is I haven't found an employer who considers my mom a dependent. However, if I had a child, it would be a dependent. And so I often think about, how do we think about some of the existing benefits that exist? And then I also think about some of the like larger from like a retention perspective. So it costs employers thousands of dollars when an individual leaves and when they have to, they lose that skill set, they lose that knowledge, and then they have to interview, hire, retrain, and potentially might not even work out. And so, how do employers actually have the right supports in place so that when an individual is going through a crisis or when a caregiver is shifting into a caregiving mode or having to, deal with an unexpected health issue, you actually have the right supports in place for this person to be able to focus on their caregiver responsibilities, but also continue to be able to thrive at work and show up. Because then you know that when that situation ends, when things settle a little bit, they'll come back. They'll want to be able to show up for you as an employer. They won't think about leaving you because you showed up for them when they were going through a tough time. And so what do you have there? You have retention. And so it's not just a nice to have. There's actually like a business model behind this. It's actually being a smart employer to be able to set up the right support. And then when we even think about, I often think about, and this is across society, not just workplaces, but I think workplaces are a huge one, is there are very well established parental leave and parental supports programs. And I often think about how can we don't even have to create a new program. We just have to adjust it slightly to include caregivers. How can we do that for caregivers so that we can also have a caregiver leave program? We can also have a back to work caregiver program, the same plan, the way that parents have a kind of back to work or like re-entry program. How do we actually do that for caregivers? So that's kind of an area that I think there's a huge opportunity for workplaces to be able to think about, incorporate so that they remain competitive. They can remain and make sure that they are attracting and retaining some of the most competitive talents and great skill sets. Because I will say, I think caregivers are extremely resourceful. We're amazing project managers. We're great communicators. We have great empathy and ability to deal with stressful situations. And so these are skill sets that we are coming and bringing ourselves to work. So, there's I think employees who will understand this will kind of see take this out as an exciting opportunity to be able to shift so that they can retain talent. And those who don't, I think will lose over time quietly.
Wow, you just recapped our entire book. That was amazing.
Yes. I was thinking the same thing. Wow. But we see that often. We hear our guests, and when they talk about the support or lack thereof with their employer, we hear that a lot. That the power of support, because it does develop loyalty, and those employees are going to stick it out because they've gotten the support that they needed at the time they needed it, so they're not going anywhere. So it's
Absolutely.
it's exactly true what you're saying. Just
And it's
quickly,
word of mouth, the other one as well. Like when you
yes,
feel supported and you
exactly.
trust an employer,
Oh
if you
yeah.
see someone in ER, if you have another family member, you say, you know what, this employer was amazing to me when I was going through
Yes,
this. I would recommend applying to them.
yes, very, very powerful um, marketing tool. Just very quickly, if you look back to Carla, the teenager, before she started her caregiver journey with her mom, the cheerleader, the teenager, the fun kid, before she had all this responsibility, what would you say to her to help her prepare for her journey as a caregiver? Just
Mm.
quickly, what would you
Yeah,
say?
really quick. I would say like language matters. So knowing you're a caregiver and recognizing that, I think it allows you to advocate for yourself. It allows you to advocate for the person that you're caring for. I think that's a huge one, especially as a young caregiver who, sometimes our systems push back when they see someone like us trying to support a loved one. And the other one that I would say is extremely important is your care and your health, your well-being matters just as much as the person that you care for. When we are not ourselves well, physically, emotionally, mentally, then we're actually not going to be able to show up for a loved one in the way that we want to, and it doesn't help anyone. When we burn out, it just creates such a challenging situation, and we need to prioritize our well-being as well. Don't wait until a crisis. Really take that time, that space, care of those professionals, that class that help you refill your cup and help you make sure that you are staying well. I think oftentimes caregiving, it's not a sprint, it's a marathon. And so we got to build that endurance for the long term. Yeah.
I see those hand claps there, Zach.
That was beautiful. I
Yes,
could tell you've been a caregiver. Or you still are.
yeah.
Yes, yes, it's definitely a core of who I am. Absolutely.
So maybe just one last thing. How can people get in touch with you? How can they find out more about the work that you're doing?
Yeah, of course. So you can find me on LinkedIn under my name, Carla Velastegui. I'm also on Instagram and also Blue Sky and X as Carla Velastegui. And my website is coming out in probably the next few months,
Mhm.
carlavelastegui.com as well. Feel free to reach out, anyone that's working with patients, caregivers, and anyone that really wants to chat about how do we bring more awareness to the space.
Yes.
Absolutely reach out. It's an area that I'm very passionate about, as you can probably
Yes,
tell.
just a little bit.
Your mother,
Just a bit.
your mother Gina is very fortunate, as you
Absolutely.
are, I'm sure, to have had a great mother, to have a great mother as well. But she's very fortunate to have you. Wow, you rock.
Definitely. Thank you so much, Carla, for joining us today. It's been incredible.
Oh, thank you both. I really enjoy this, and I'm so glad that we can bring awareness to caregivers.
Absolutely.
Thank you so
Team,
much.
team effort.
Okay.